Hello, for this discussion, I will be talking about the core value of advocacy in nursing, as outlined in the National League for Nursing Educational Competence Model. Advocacy is a foundational concept in the nursing practice. As it is core, advocacy means speaking up for and supporting patients to ensure their rights, preferences, and best interests are respected. According to the National League for Nursing, core values like advocacy are essential because they form the foundation for all nursing roles and responsibilities. National League for Nursing 2010. Advocacy plays a role in patient care because nurses are often the closest providers to the patient. The American Nurses Association emphasizes that nurses have an ethical obligation to promote, advocate for, and protect the rights and safety of the patients. American Nurses Association 2015. This responsibility directly impacts patient outcomes, safety, and trust in healthcare system. One example that highlights the importance of advocacy involves a 97-year-old patient who was admitted to the facility with altered mental status. Initially, she was confused, and discussions began about placing a feeding tube. However, as her condition improved, she became alert and oriented enough to clearly refuse the G-tube placement. Despite her refusal, the family is insistent that the procedure be completed and use their medical power of attorney to sign consent for the surgery. At this point, the nurse recognized a critical issue. The patient now has decision making capacities and expressed her wishes very clearly. Instead of simply following the signed consent, the nurse acted as an advocate. She contacted the healthcare team and communicated that the patient was refusing the procedure. She also recommended a competency assessment to determine whether the patient could make her own medical decisions. The patient passed the competency assessment, confirming that she was capable to decide, and as a result, the surgery was denied and the patient's wishes were respected. The situation demonstrates how advocacy protects patient autonomy. Ethics and legal standards state that a competent patient has the right to refuse treatment, even if others disagree. Fozar 2020. Without the nurse speaking up, the patient may have undergone an invasive procedure against her will. Advocacy ensures the ethical care, upheld legal standards, and respects the patient's dignity. The impact of advocacy extends beyond individual cases. It promotes patient safety by preventing inappropriate treatment and reinforcing ethical principles such as autonomy, beneficence, non-maleficence. Advocacy also plays a role in reducing healthcare disparities by ensuring patients receive fair and equitable care. However, advocacy is not always easy. Nurses may face pressure from families, providers, or system constraints. It requires confidence, critical thinking, and a strong professional identity to speak up. But ultimately, our responsibility is to the patient first, as supported by the Nursing Code of Ethics ANA 2015. In conclusion, advocacy is a vital core value that shapes nursing practices at every level. It ensures that patients are heard, respected, and protected. By embracing advocacy, nurses improve patient outcomes, support ethical care, and uphold the integrity of the profession. Thank you.